This is Heliox, where evidence meets empathy. Independent, moderated, timely, deep, gentle, clinical, global, and community conversations about things that matter. Breathe easy. We go deep and lightly surface the big ideas.
Hey everyone, and welcome to another deep dive. Today we're taking a closer look at an email from one of our listeners who shared some concerns with CVC Radio about the connection between the doctor shortage and COVID-19. It's really interesting stuff, and we thought it deserves a deeper look. The listener points out a pretty alarming statistic that 1 in 5 physicians may have left practice because of long COVID.
Wow.
And, that's a huge number. It really raises questions about the long-term impact of this pandemic on our healthcare system.
Yeah, no, absolutely. It's definitely something to be concerned about. Studies are showing that long COVID is having a significant impact on the healthcare workforce, and not just in terms of those who got sick initially.
Right.
The email brought up a really important point about the risk increasing with each infection.
Yeah.
And the research suggests it's not just a simple addition, like the likelihood of developing long COVID might actually increase exponentially with each round of COVID you get.
So it's not just about getting COVID once, it's about the cumulative impact of multiple infections. And the listener also mentioned this interesting point about a 17-year lag in something called transitional medicine. What exactly did they mean by that?
Oh, I think they meant translational medicine, which is basically the process of turning those scientific discoveries we see in the lab, into actual treatments and guidelines for patients. And it's a very complex process, it can take years, sometimes even decades to fully develop.
Yeah, I see. So it's like a pipeline.
Exactly. Think of it like this. Researchers might discover a new drug in the lab that seems promising for long COVID treatment, but it could be years, literally years, before it's available to patients.
Oh, wow.
Because it has to go through rigorous testing and get all the necessary approvals.
That makes a lot of sense, but it's also pretty frustrating, right? It's like, we know there's this problem, and there might even be solutions out there, but they're stuck in this long pipeline. So what does that mean for people who are dealing with long COVID right now? What can they do?
Well, it means there's this real gap between what we know and what we can actually do, right? The research is constantly evolving and changing, but the time it takes to translate those findings into widely available treatments, it can leave a lot of people feeling stranded, like they're just waiting.
Right.
And the listener's email really hit on this with all those statistics about infection rates and how it's transmitted. They mention 1 in 49 people in the U.S. are currently infected, and something like 60% of them don't even have symptoms.
Yeah, those are some pretty mind-blowing numbers. And it makes you wonder about all this testing we've been doing, especially with the limitations of rapid antigen tests, as you mentioned earlier.
Absolutely. Rapid tests are super convenient. We all know that. But there's a higher chance they might miss an infection and give you a false negative.
Oh, so you might think you're in the clear.
Exactly. You could be infected, but the test doesn't pick it up. The molecular tests are more accurate for sure.
Right.
But often they can be harder to get.
Yeah. That makes sense. So we're dealing with a situation where a lot of people might be infected without even knowing it, and those rapid tests might not be catching all those cases. This also ties into the listener's point about COVID-19 being primarily airborne, which they feel hasn't been emphasized enough.
Yes, absolutely. And they made some really great points about better masks.
Right. They even mentioned a specific Canadian company, Press Index.
Yeah, I saw that.
I'm actually curious to hear your thoughts on the effectiveness of different types of masks. The listener mentioned surgical masks might not be cutting it, especially for people with facial hair.
It's a great point. So surgical masks, they're designed to block those larger droplets, right? But they're not really as effective against the tiny, tiny aerosol particles that can kind of linger in the air.
Okay.
N95 masks, on the other hand, offer a much, much higher level of protection, because they filter out, a much greater percentage of those tiny particles. And they tend to fit more snugly, too, which is a big deal if you have facial hair.
It makes sense. You don't want any gaps.
Exactly. You want a good seal. And thinking about all this really highlights the listener's point about the need for, much more comprehensive protective measures,
right,
especially in healthcare settings. The listener mentioned a staggering statistic. 30% of COVID cases are actually acquired in healthcare settings.
Wow, that's a lot. It's not just about protecting the physicians, is it?
No, it's about protecting everyone in those environments. Nurses, technicians, administrative staff, cleaners, everyone. Everyone who steps foot in those buildings.
So we've got this situation where a very contagious virus is still circulating, and it's potentially having a huge impact on the healthcare workforce.
It is.
And the listener feels this isn't getting the attention it deserves. They even used a pretty strong phrase in their email, misinformation by continued omission. It's a serious accusation.
It is, but it's also understandable why they might feel that way. There are a lot of complex factors that go into how the media covers a story like this.
Yeah.
And sometimes those factors can lead to certain aspects being, well, downplayed or even ignored completely.
Okay, I see. So it's more nuanced than just, blaming the media.
It's complicated. Media outlets have to make choices about what they're going to cover, how much emphasis they're going to put on certain stories.
It's a tough job.
It is. They're constantly balancing audience interests with editorial direction, resource constraints, and all sorts of other things.
Yeah, it's a lot to juggle.
It really is.
But this has got me thinking. Is there a chance that government messaging and public health policies are also influencing what we see in the news? Could that be a factor too?
Oh, absolutely. Public health agencies, government bodies, they play a huge role in shaping how we think and talk about these health issues.
Right.
And sometimes there's this concern about causing panic or undermining trust in the official guidance.
I can see that.
And that can lead to a more cautious approach to reporting, even if it means some information gets left out.
So it's not always a deliberate attempt to hide information. It's more like...
It can be a very subtle thing and often unintentional, driven by these larger concerns.
Yeah, like walking a tightrope.
Exactly.
Yeah.
And we can't forget about corporate interests either,
You're right. Pharmaceutical companies, hospitals, big government agencies, they're all massive advertisers.
Exactly. And that can definitely create some pressure on media outlets, to maybe avoid stories that could be seen as too critical.
Right. It's like biting the hand that feeds you.
In a way, yeah.
Okay, so we're seeing how all these different factors can create this kind of blind spot in the media where certain issues just don't get the attention they deserve. But what about the scientists themselves? The experts. The listener mentioned this idea of relying on outdated guidelines. Experts who might not be up to date on all the latest research.
Yeah, it's another big piece of the puzzle. Science, is constantly evolving and changing, but it does take time for those new discoveries to filter down, to make it into those practical guidelines.
It's like the trickle-down effect.
Kind of, yeah. And journalists often turn to the established experts, the big names in the field.
The ones everyone knows.
Right. But those experts might be hesitant to jump on board with, brand new ideas until they've been really vetted by the whole scientific community.
So it's not necessarily a case of people deliberately hiding information. It's more like a lag between what's happening in the labs and what ends up becoming common knowledge.
Exactly, like a game of telephone.
And then you have the whole challenge of trying to communicate this often very complex scientific information in a way that everyone can understand without sacrificing accuracy.
It's a delicate balance, for sure.
You brought up some pretty technical stuff in your email, things like AA-Sure, 241 ventilation standards, and far UVC light.
Oh, yeah, those are a bit niche.
I have to admit, I wasn't even familiar with those terms before reading your email. Could you break those down for me for our listeners who might be hearing them for the first time?
Sure. So think of AHRA 241 like a blueprint for safer indoor spaces, It's this set of guidelines for ventilation and air quality specifically designed to reduce the risk of airborne infection.
Oh, I see, like a building code for cleaner air.
Yeah, precisely. Like building a house with, super strong walls and a really good air filtration system.
So it's not just about cracking open a window.
No, it's way more than that. It's about taking a really systematic approach to how we think about and manage air quality.
Okay, that makes sense. And what about the far UVC light? What is that exactly?
So imagine a special kind of light that can actually kill viruses in the air.
Whoa, for real?
Yeah, but it doesn't harm people. That's the really cool part.
That sounds almost futuristic. Is that technology readily available right now?
It's still kind of new, but it's definitely showing a lot of promise.
Wow, it's exciting to think about.
It is. There are actually companies already developing and installing far UVC light systems, in places like hospitals, schools.
Oh, wow. So they're actually putting it into practice.
Yeah, which is really encouraging.
So we have these potential solutions out there, but they haven't really become mainstream yet. And you mentioned something else in your email that really caught my eye, the idea of using CO2 monitors to gauge ventilation effectiveness.
Oh, yeah.
I had never even thought about that before, I have to admit.
It's a really neat trick. Think of a CO2 monitor like your own little air quality watchdog.
I like that.
Imagine you're in a crowded concert, right?
Yeah.
A high CO2 reading on that monitor would be like a red flag telling you, hey, the ventilation in here isn't doing so well. Maybe move to a less crowded spot or put on a better mask.
That's such a helpful way to think about it. It really makes you realize how these things can be used in everyday life, not just in, scientific settings.
Exactly. It's all about empowering people with information so they can make informed decisions.
I love that. And your email doesn't just, raise concerns. It actually offers some pretty concrete advice and suggestions.
Well, it's about taking action, right?
Right. You urged CBC to do some deeper reporting on these issues, and you encouraged listeners to really check their insurance policies, which is, I think, really proactive.
Yeah, I mean, we're not just passive bystanders in this. We all have a role to play in shaping the conversation and really advocating for positive change.
It's about taking ownership.
Absolutely.
So we've talked about all the complexity of media coverage, the challenges of translating scientific research into things that can actually help people, and the importance of each person, being informed and proactive. What do you think is the most crucial takeaway from all of this for our listener and for anyone else who might be listening and feeling a little overwhelmed by all this?
I think the big takeaway is we need to be critical thinkers. Don't just take everything you hear at face value, whether it's from the media, from government officials, even from scientists.
It's about questioning everything.
To a degree, yeah. Be willing to ask those tough questions, to really dig in and get different perspectives, and most importantly, advocate for yourself.
Don't be afraid to speak up.
Exactly. Speak up for yourself, for your community, for what you believe in.
Advocate for change. So well said. It's about being informed, being engaged, being empowered to make the best decisions for your own health and well-being.
Your health is in your hands.
And speaking of well-being, you also brought up this really important point about the long-term consequences of COVID, especially when it comes to disability and insurance coverage.
Oh, yeah.
You seem particularly worried about insurance policies that often exclude coverage for those long-term disabilities that stem from infections.
It's a harsh reality, and I think a lot of people aren't even aware of it. It's a good reminder for all of us to really take a close look at our own insurance policies.
Don't just assume you're covered.
Right. Know what you're covered for, what you're not. This whole pandemic, it's thrown us a lot of curveballs.
It has.
And it's important to be prepared for, the unexpected.
We've covered so much in this deep dive, but I feel like we're really just scratching the surface of this massive, complex issue.
Oh, definitely. There's so much more to explore, and it's going to be an ongoing process.
It's a journey, not a destination.
It really is. This isn't just about COVID-19. It's bigger than that. It's about how we deal with all these public health challenges in general, how we share complex information with each other, how we help people take control of their own health.
And ultimately, it's about recognizing that we're all in this together.
We are.
We have this shared responsibility to build a healthier, more informed world.
Absolutely. We're all part of the solution.
Wow, you've really given us a lot to think about here. This deep dive, I feel like it's really opened my eyes to how all these different issues connect, I bet our listener is feeling the same way.
Yeah, it's not a simple problem with a simple solution, that's for sure.
Not at all. We've got long COVID and its impact on healthcare, the way the media does or doesn't cover it, the role of science and all the research going on, and, just our own individual responsibility to really stay informed and proactive.
It all ties together.
It does. And speaking of being proactive, you touched on something in your email that I wanted to circle back to. The whole issue of emerging treatments for long COVID. What's the latest on that front?
Well, the truth is, there isn't a magic cure for long COVID right now.
Yeah.
You mentioned being frustrated with the limited options available, and I get it, I really do. But I do think there's reason for hope. A lot of researchers are working really hard to understand how long COVID works, really get down to the mechanisms of it so they can come up with effective treatments.
That's encouraging to hear.
Yeah.
What are some of the most promising areas of research right now? What should people keep an eye out for?
Well, there are several different avenues being explored. Some researchers are looking at repurposing drugs that already exist, seeing if they can be used in new ways. Others are trying to develop brand new antiviral therapies. And there's even some research into treatments that could modulate the immune system. It's a rapidly changing field.
It sounds like it.
It is, and that's why it's so important to stay updated, really pay attention to the latest news and research.
So while we might not have all the answers right now, it sounds like there's a good chance that future discoveries, breakthroughs, could really offer some relief to those dealing with the long-term effects of COVID.
I believe so, yes. And until then, I think the most important thing is to focus on what we can control, right? Taking those steps to prevent getting infected or reinfected, advocating for better public health policies, and supporting all the research going on to find effective treatments.
It's about taking action, doing what we can. Well, this has been an absolutely enlightening conversation. We've covered so much ground today, and I personally feel like I have a much deeper understanding of this issue now,
Yeah.
all the layers and nuances.
Me too. It's been really great. It's a good reminder that even when things seem uncertain or complex, knowledge is power. The more we learn and understand, the better decisions we can make.
We become better advocates for ourselves.
Exactly.
We want to thank you, our listener, for sending in your email. It was really thought-provoking and has given us so much to discuss today in this deep dive. You've really sparked a conversation that I think is so important right now.
You've definitely given us all a lot to think about.
You really have. And everyone listening, as we wrap up this episode, we want to leave you with a final thought, a question to consider. If you were putting together a news segment on COVID-19 today, what would you focus on? What information would you make sure to include, and why? What stories would you tell? What voices would you bring to the forefront? Think about it. Because remember, it's not just about passively taking in information, It's about critically examining it, sharing it thoughtfully with others, and most importantly, using it to empower yourselves and the people around you. Until next time, stay curious, stay informed, and stay engaged. Thanks for listening today. 4 recurring narratives underlie every episode: boundary dissolution, adaptive complexity, embodied knowledge, and quantum-like uncertainty. These aren't just philosophical musings, but frameworks for understanding our modern world. We hope you continue exploring our other podcasts, responding to the content, and checking out our related articles at helioxpodcast.substack.com.